Okay, hello everybody. Thank you so much for joining us today. I'm Des with My Destination, your expert on relocation here in Puerto Vallarta, Mexico, the beautiful town where we live over the rainbow over here. And today I get the pleasure to talk with Robert, who is the business development manager of the Lakeside Medical Group. It was really, really important for me to meet with him today and discuss what he offers through his medical group, how his health insurance programs can help digital nomads, retirees, veterans, what type of options are available for expats who are wanting to live and retire in Mexico. And I had a lot of really great questions for you today, Robert. So, again, thank you so much for taking the
I'm
time to
looking
meet
forward
with
to it.
me. Thank you.
Well, thank you for
Yeah.
the invitation. Thank you for the invitation. It's a real pleasure to be here with you. You are correct. Puerto Vallarta is just heavenly. It's a beautiful place to retire and to go visit. So we're very pleased to be able to be here with you and to offer some great medical options for people who are visiting Puerto Vallarta. So that's what
Fantastic.
we're here for.
Perfect. And just so I understand correctly, Lakeside Medical Group is actually something that is offered all around Mexico, right? You have this available to several
Correct.
people?
Correct. We're a Mexico-based comprehensive managed medical program. So it's a health program, okay, that works with your current U.S. and Canadian insurance plans. Most of them, not all of them. So
Mhm.
we can go into the detail about that a little later. But yes, we basically extend your coverage to Mexico.
Oh, that's fantastic. A lot of my clients
Mhm.
are really, really excited to hear that information. I think
It's one
that,
of the main concerns. Sorry for interrupting. It's one of the main concerns that people moving down here have is, what am I going to do for insurance? And the options are available, but they're not as easy and they're
Mhm.
expensive as well.
Absolutely. Yeah. And you're absolutely right, Robert. I think it's probably the number one concern with people moving here. So
Right.
again, thank you so much for taking the time to meet with me today. So before we
Pleasure.
dive into all of the wonderful questions I have for you, would you mind telling me a little bit about yourself and how you got started in this industry, where you're from, and what made you,
Sure.
want to be the person that represents the entire medical group?
Sure. Pleasure. I live in Querétaro, and I've lived with my family here for about almost 20 years in Mexico. I started off in Monterrey and then came down to Querétaro. I moved here with an international company as director, and I founded that company here in Mexico. But then over time, when I reached the age of 60, I was driving into Mexico City and driving back on weekends here to Querétaro, which is about 2.5, 3 hour drive when the traffic's good. Sometimes it could be 7 hours. So I decided it was time to uh, have a life, basically. And ever since 3 years ago, I retired. I thought I retired, but my wife has had a wonderful business relationship with a company called SkyMed, and I started helping her with that, and I got very imbued in the whole medical field in medical care and for expats here in the country. So basically, I learned from that. I also learned with some insurance companies, my own insurance that I have down here. I'm not old enough for Medicare,
Mhm.
so um, I got into it and I saw an opportunity at Lakeside and I took it and it's been absolutely wonderful ever since. We are offering some really great solutions for people moving down here. And it is a no-brainer to an extent
Yeah, yeah, it really sounds like it is. So, what a great
because
adventure
you
to get
life,
you to where you are
exactly.
now.
Absolutely.
Yeah,
Absolutely.
yeah, that's great.
Yeah.
So what exactly is the Lakeside Medical Group and who is it designed to serve? Because a lot of people they don't really know, they don't really understand. They kind of, I mean, insurance I feel like is speaking another language anyways. It's really one of those things that
I
you
know
just it's
it's a
so
little convoluted.
confusing. Yeah, so what
Yeah.
exactly is it and who's it for?
We actually have a very simple, straightforward program. We do not sell insurance. We're not an insurance company. Um, we work with your current insurance company to extend their coverage to Mexico. How do we do that? We have our program basically is a comprehensive managed medical health program. Okay, we work very similar to an HMO in Mexico. So we have a network of hospitals and doctors down here. And if you have the correct insurance policy plan from the US or Canada that offers you and allows you coverage outside of the United States for emergency and urgent care treatment, then we can actually use that very same plan to offer you that emergency and urgent care here within our network of hospitals. So
Wow.
it's very
Okay.
simple, very straightforward.
So, and then that sounds like it is an option available to anybody that has
It is
that out of country
correct.
support.
Right.
Okay, so that's interesting.
75% of our membership are Medicare Advantage seniors.
Mhm.
Why? Because they're really the ones that are, or that we find are mostly moving down here from the US as expats.
Mhm.
Okay. We do have quite a few Canadians, but the Canadian insurance market works quite differently from the American one.
Mhm.
So most Canadians have what's called a provincial insurance, and most provincial insurance does not allow for coverage outside of Canada. So there are few travel insurance plans, Canadian insurance plans that we can work with, and we can work with federal Canadian insurance plans because they allow for coverage outside of Canada. So
Okay.
most of our market here is the American senior having a Medicare Advantage program.
Got it. Okay. And that makes sense. I mean, I do have a lot of retirees on that Medicare program that are moving to Mexico, but I also have a lot of younger digital nomads and families like that. But I will
Correct.
say the priorities are a little bit differently for those who are not quite in that age bracket yet because they're just not as focused on health insurance as the older ones are,
Right.
which
Right.
makes sense that why a majority of your people are
Right.
75% are part of that Medicare Advantage. So, of all of the types of insurances that you do accept, which ones are the ones that you actually will take and you will work with? Some that maybe people will be familiar with. And is there a fee to join?
Okay. We will work with any insurance plan that allows for coverage outside of the United States or Canada.
Hmm.
Okay. So any of them will do. We do have quite a few uh, younger people under 65 who are members. A lot of them happen to be digital nomads. In other words, people who are self-employed who move down here and have an insurance plan, Blue Cross Blue Shield from the U.S.
Hmm. Okay, that
And
one's super
that
common.
plan allows for coverage outside of the U.S. So we will extend that coverage to them. Again,
Okay.
this is only for emergency and urgent care. It does not include um, healthy well checks or appointments, scheduled appointments for checkups, that sort of thing. So it's
Yeah.
only for emergency and urgent care. And later on, we will discuss what the definition of those two terms is.
Hmm.
Um, so yes, we can offer basically insurance to anybody who has a health plan that allows for coverage outside of the U.S. Okay.
That's
And there is
fantastic.
no charge, and there is absolutely no charge. Our enrollment is free. And even though your plan may have deductible and coinsurance attached to it as part of the plan, we do not charge those down here. So we're basically improving on your health plan to an extent.
That's amazing. So
So
people are not
yes,
paying a monthly premium. They're not paying an enrollment
correct.
fee. They're not paying
Not
to
to
talk to
us,
you. Not to you.
not to
Yeah.
us. They're paying for their insurance, their regular insurance up in the U.S. or Canada,
Hmm.
right? And in the case of Medicare, they're paying on their Part B, they're paying about 185, $200 a month. That is deducted automatically from a Social Security check,
Hmm.
and that's how they pay. They have their insurance down here. So there is no, we don't charge our members anything, basically.
Wow.
However, if they do go to the hospital, for example, for an urgent care appointment, we will charge them 100 pesos. That's it. 100 pesos, basically $5.
Yeah, which in the
Okay,
current
five
exchange, I
US.
was going to say is about
Yeah.
$5. Yeah.
Yeah,
Wow,
five
that is
dollars and
amazing.
25 cents. So yes, so that's all of the feeds that are available, and it's a tremendous program. Really, it is,
It almost sounds too good to be true, Robert. Like it
doesn't it?
just, yeah, it really does. And the
Yeah.
great thing is, just so that our audience knows, as far as like the regular wellness checks and regular blood work and the annual general health profile and the things that we get, I actually don't have any insurance that covers those basic things because the cost of those things at the hospitals is so inexpensive, anyways. I actually personally
Relative to
use.
the US, relative to the US.
Exactly. Yes. Yeah.
Yes.
Well, I use the Vallarta Medical Center, which I believe is one of the
Yeah, it's
hospitals
part
in
of
your
our network.
network. Yeah. And
Yes, it
so
is.
it costs me less than, I would say, 150 to 200 US dollars per year to get those
Yep.
general health things completed, including blood work.
Right.
And one of the most fantastic things that I love about the way that the medical system works here is I don't have to go see a doctor to get referred to a specialist, to get referred to another specialist, to get referred to the main guy that I need to see. I can go
Right.
straight to the main person.
Straight in.
And that's
Absolutely.
so
Hmm.
great. That saves me
Yep.
time, it saves me money, it saves me stress, and I can get
Yeah.
whatever the immediate acute problem is completely solved, and it doesn't cost me a lot of money out of
Exactly.
pocket. So,
Exactly. And really the concern is what happens in case of an emergency, because obviously when compared to the US or even Canada, the cost of an emergency, for example, broken hip is maybe a tenth down here, but still it's quite a bit of money. And
mhm,
if you can avoid that and have us extend that coverage for that emergency, and it costs you, I mean, if you stay overnight, 2, 3 nights will cost you 3,000 pesos. That's a no-brainer as far as I'm concerned.
absolutely. Yeah, that sounds so securing. So,
Yeah,
now I know that you talked a lot about the majority of your people have the Medicare Advantage plan. And I know that those people who are coming down here to retire that have that Medicare Advantage want to know, is it something they can actually use? Is it something that you're going to accept? Is it something that you're willing to work with? So, what are some things that the Americans specifically would need to know before enrolling with you that have that Medicare Advantage plan?
sure. Uh, we don't work with all Medicare Advantage plans. What people have to realize is that there are over 450 different Medicare Advantage plans.
Wow.
Advantage
Okay.
Advantage plans are basically the Medicare system, the Medicare health government provided insurance plan that was given over to private insurance companies.
Mhm.
Okay. So when you retire, you have the option of staying within the traditional Medicare government plans, or go outside of that and go with a Medicare Advantage plan. Now, I have to say this quite honestly, because a lot of people say, well, Medicare, there's absolutely no way you can use it outside of the US.
Mhm.
And they're referring to the traditional Medicare Advantage, Medicare plans. I'm sorry, the Medicare plans, the government run Medicare plans. Those with a supplement, also known as Medigap, those plans basically do not allow, or only allow for 60 days outside of the U.S. and a $50,000 maximum lifetime per for whatever event is covered outside. So
Oh,
they're
I've heard that a
basically not
lot. Yeah.
offering, yeah, they're basically not offering any coverage outside of the U.S.
Mhm.
Okay, but if you go with a Medicare Advantage plan, depending on which plan you choose, just make sure that you choose a Medicare Advantage plan that allows and has no limitations for treatment outside of the U.S. Okay, and
Mhm.
there are plenty of those around. So those are the ones that we work with. There are
Okay.
some Medicare Advantage plans that only, for example, offer 50,000 limit, um, and we cannot work with those because you never know how much exactly an emergency is going to cost.
Right.
So we need plans, and we work with plans that Advantage plans that do not offer any limitations.
Okay. And now, but they still need to have a US address to even qualify for
Absolutely.
those Medicare Advantage
Correct.
plans, right?
Yeah, for
Okay.
Medicare, because Medicare is still part of the Medicare system.
Mhm.
You need to have a zip code, an address in the U.S., okay, a residence in the U.S.
Mhm.
And once you have that, you provide that. And according to your zip code, you will get the number of plans that are available in your area. So you can choose, sometimes there might be 20, 25 different plans. and you get to choose from those which ones benefit you the most. In other words, which ones have your hospitals, which one has your doctors, right? And if
Mhm.
you have that Medicare plan, Advantage plan, and it also allows you to coverage outside of the U.S. for emergency and urgent care, then you've got it all, basically.
Mhm. So can they still live in Mexico full time as long as they just maintain that US residency and then still qualify for the proper
Depending on the
advantage?
plan, people can live here long term without any problem. Every time you go back to the States to visit somebody, even if it's for a day or two, you're basically resetting the clock. So
Mhm.
yes, most Advantage plans do not have any limitations. But then again, it really depends on the type of plan that you choose. And we do have, and you would have also access to different Medicare Advantage agents that know which plans are the best to be used in Mexico.
Okay, so people can contact you or one of your agents and then they can talk
Correct.
with you through this
Absolutely.
before they make a choice. Awesome. And
Right.
is it just out of curiosity, if people are already signed up with one Advantage plan, they realize it's the wrong one after talking to one of your agents, is it something that they can easily change or are they locked in
Yes.
for life?
Switching plans is
Oh, good.
very easy, and it costs no money. And most of the plans that are being offered today are zero premium plans. Because bear in mind, you're already paying, once you're a retiree, you're paying about $185 is automatically deducted from your Social Security check,
Hmm.
right?
That
So
does
you're
not hurt.
already
Yeah.
paying for it, and you've paid for it your whole life. So it's a plan that if you can choose one that you can use in Mexico, why not? I mean, you've paid for it your whole life, right?
Yeah, absolutely. Yeah, I fully agree. So, can Canadians or the younger digital nomads enroll if they don't have any Medicare Advantage? Yes, right? Because you take any type of
Yes,
insurance that has that
correct,
international. Okay.
correct,
Okay, so that's
correct,
good to know for the younger people or the Canadians as well, because I know the
right.
Canadian system
Just
is really
just make
tricky.
sure that when you choose that plan, it does offer coverage, emergency and urgent care coverage outside of their country.
Okay.
That's basically what you have to look out for.
Okay. And then they can call you or one of your representatives and you'll
Absolutely,
be
sure,
sure to support them with that. I think that's a
sure,
fantastic service, Robert, for sure.
yep,
So, what is the
absolutely.
actual enrollment process and how long does it take?
If I told you, you'd just laugh.
Really? Okay.
It is so simple. It is so
It's
simple.
the
You can
Mexican way,
either
right?
reach out, yeah, you can reach out to me or you can do it online yourself. Basically ask for your name, your details like phone number, email, address where you're going to be in Mexico. And then it will ask you for a copy front and back of your insurance card and a copy front and back of your government issued ID. It can be a passport. Obviously, you're not going to take a picture of the back of the passport. You just need the picture page,
Hmm.
but that's it. Once you have that, you can just press submit and, we will usually respond in 24 hours. The whole enrollment, let me be clear about this. That is the beginning of the enrollment process. Okay.
Okay.
That first step takes about 5 minutes. Okay. In 24 hours, we will respond with an electronic, um, document that needs to be signed by the person who wants to be a member. And there, basically, you're signing uh, an agreement that says that you allow Lakeside to um, be your agent, basically, to represent you before in front of the insurance company. So it's an assignment of benefits contract. Okay. And so we have the right to bill for you once you go into the hospital here for an emergency and urgent care. All right. And that assignment of benefits contract allows us to, once we submit that with the full information of your medical procedure, your medical notes, et cetera, a complete package, we submit that to your insurance company and that is paid. The positive side of this is that you don't have to be involved in any of the reimbursal process. You don't have to do any paperwork. You don't have to fill out any forms. You just go to the hospital, are taken care of, and leave. That's all.
Oh,
We
how
take care of
wonderful is
everything.
that?
Yep.
I bet
Yep.
that takes off so much stress from people because the last thing they want to do when they're in an urgent or an emergent
Right.
situation is deal with an insurance company. That's the last thing anybody
Right.
wants.
And you've got to translate the documents, the medical notes. You've got to offer obviously exchange rates. You've got to. So it takes about a year for most people to get their money back. That they can do it as a reimbursable if they choose to do it as a reimbursable process. And they usually get about 80% of their money back. Okay. Because
Mhm.
remember that most plans have a deductible, most plans have a coinsurance.
Mhm.
And so all that is deducted from the total charges. Whereas if you
Okay.
work with us directly, you don't have to deal with any of that. We take care of everything, basically.
Wow, that's fantastic. So, what type of an
Mhm.
ID card do the members receive, and how should they use it if they were to come in an emergency?
Sure. Once they fill out this electronic form, they submit it back to us. At that point, we go back to the insurance company and we ask them for a confirmation of benefits. At that point, the insurance company says, yes, this person is covered. And these are the limitations, or there are no limitations, whatever. So we are working with the insurance company. Um, Once that happens, we receive the COB. Then at that point, we send the new member, a welcome packet. Okay. In that welcome packet, we have instructions of what to do in case of an emergency or an urgent care situation. And they also get a virtual card, which most insurance companies and most people now are used to that because all insurance companies are doing that. They send
That
you your
makes
card
sense.
virtually, you
Mhm.
print it out, you laminate it and put it in your pocketbook. And if at all possible, you also share it with a lot of your friends in Puerto Vallarta
Mhm.
or family members so that they know that in case you can't speak for yourself, you have to go to the in-network hospitals.
Okay, that makes sense. That makes sense. And I
Mm-hmm.
definitely think that it's very, very important, especially when you're living abroad, to plan ahead for these things and to
Yep.
have know who you're going to contact, know what the process is, know who's going to be your, so to speak, power of
It is
attorney, for
very
lack of better
important.
words.
Very
Yeah,
important.
very
Yep.
important.
Yep.
Yes, I've actually learned this with a couple people who have dealt with some emergencies here, and even
Yep.
some deaths as well. And it's something
Mm-hmm.
that
Yeah, you need to
it's
have a village around you basically to cover for you in case you can't speak for yourself. It's very
Exactly,
important.
yeah. One thing
Yeah,
I did notice, though, that was interesting about Puerto Vallarta that I've never noticed living in any other parts of the world was that even if they weren't an immediate family member or even a super, super close friend, just the network alone of the expats and the local Mexican people here,
absolutely.
they are so supportive and so helpful and so willing to be there for you that the sense of community that Puerto Vallarta offers, as opposed to other places around the world, is just it's incomparable. It's unmatchable. And
Yep.
it was really an amazing thing to see how everybody came together in this community for
Yeah,
going
the
back in time.
community, once you move to a place like Puerto Vallarta, I mean, it's a small community. People get to know each other and become family.
Yeah.
So they're very important to you in case of emergencies, in case you need I don't know, a cup of sugar,
Hmm.
whatever.
Yeah.
Oh, by the way, I also want to mention the other hospitals that we have in Puerto Vallarta as part of our network.
Hmm.
We have Hospital Medicist as well. Okay, and the Laboratorio Silva
Okay.
in Puerto Vallarta. So we have a range of three different medical facilities that you can go to
Hmm.
and be taken care of.
I haven't heard of the Laboratoria Silva yet, but I've heard wonderful things about the Medicist.
Yes,
And I
yes.
personally use Vallarta Medical Center, so I'm very happy with them. They're
And they're
great.
wonderful.
Yeah.
They're one of the top rated places in Vallarta. So,
Oh, I love them. Yeah, and they speak English as well, and they're just super supportive and easy,
yeah,
and I can
yeah,
walk in if I have to, and that's a great thing. So, okay, so let's talk about emergencies because this is what
sure.
my clients and anybody moving to Puerto Vallarta is the most concerned about.
Sure.
So,
Absolutely.
what should someone do if they need urgent or emergency care in Puerto Vallarta? What should they do?
Okay. If you don't mind, I'll start with the definitions so
Yes,
that people know
please.
exactly what constitutes an emergency and what constitutes urgent care. We basically are guided by the American Medical Association definitions for each one of those terms. So an emergency is a sudden change in your health condition that requires immediate assistance and that threatens your life or limb. Okay,
Okay.
so that's an
That's very
emergency.
clear.
So if,
Okay.
yeah, all right. And urgent care is a change in your health condition that requires immediate assistance or immediate attention, but does not threaten your life or limb.
Okay. Okay.
All right. So, for example, a very bad sore throat would be an urgent condition because, obviously you're sick and it requires immediate attention. If you fall and need stitches, that's urgent, an urgent treatment that is
Hmm.
required.
So then
Right.
something that would fall under not part of the urgent or emergent would like be like an ongoing diabetes thing, or what if someone went into
Diabetes, cancer,
okay.
melanomas, that sort of thing. We realize that they are urgent and emergencies to the person who has them,
Of
but
course, yeah.
it's not something that's going to be immediate
Hmm.
because there is a treatment, there is a procedure to take care of that over time. So those do not constitute or are not covered under a definition or the
Okay,
American
so
Medical Association's definition.
okay, so just for clarification to make sure that I and my clients understand
Sure.
perfectly, if somebody has diabetes and their day-to-day, insulin or checkups or whatever is not covered. However, if that person were to go into a diabetic shock or have some sort of a,
At that point,
blood
it
sugar
becomes an
drop.
emergency. Yes,
Okay,
correct.
so that's good to know. I love the
Yeah,
differentiation between the two.
yeah,
Okay.
yeah. For
So,
example, last week I was in Mexico City doing a presentation, and a lady showed up with COPD, and she says, "Would my COPD be covered? Could you offer me coverage for this?" And we said no, because it is an ongoing condition. It's a chronic condition. All right. And so we wouldn't be able to cover your doctor's visits, your oxygen tank, all of this. However, if you had a COPD emergency situation where you can't breathe anymore or you have an attack, at that point it becomes an emergency. We treat the emergency. Okay. And once she is released from that emergency, we no longer are able to cover her. So we only treat the emergency at that point.
okay, that is a very, very good example. And I hope that that lady will be okay in her situation because it sounds like she'll have some good support with you guys. So, what
Yeah.
should someone do if they had the emergency? Do they just go straight to the hospital? Do they call 911 in Mexico? Like what do
Right.
people do if they have an emergency?
Yeah, it's a little tricky. Um, First, you need to call us. Okay,
Okay.
if you are able to, okay, we would ask you to call us first. We can instruct you on what to do because it bears mentioning our staff that is answering the phone 24/7, 365 is bilingual.
Mhm.
So we would be able to talk with you, calm you down, give you instructions, tell you how to get to the hospital. At the same time, we're going to call that hospital. Okay. And they will be ready for you when you arrive.
Mhm.
All right. So when you arrive, most hospitals here in Mexico are trained to ask for a credit card the moment you set foot in the admissions through your emergency room.
Yeah, which is
Okay.
very different here than in the States and Canada. There, they treat you
Absolutely.
first, bill you later. Here, they bill you first, treat you later.
They will ask for that credit card, and that's what they're trained to do. So if you get to the hospital and it's an emergency and you haven't called us, they're going to ask you for a credit card. Okay. We've had, unfortunately, some people um, who have given the credit card because they didn't know what else to do, or perhaps they showed the Lakeside card and the person in admissions at that point didn't really realize what Lakeside is. Okay. Because not everybody knows what Lakeside is at the admissions office. All
Mhm.
right. That's what we would like to call first. All right. Once you give a credit card, we cannot reimburse you. All right. So
Okay.
if you give a credit card, you're on your own and you have to file for reimbursement with your insurance company. You have to go through the whole process that I mentioned earlier.
Okay.
All
Okay.
right. So the best thing to do is call before you leave for the hospital. Call us. Second best is once you get to the hospital, call us from the hospital before you show credit cards, before you go into admissions. Just sit down and say, all right, let me call Lakeside. and we will call and alert all the people in the admissions office that you're a Lakeside person and you're allowed in, and you will be allowed out without having to pay a single cent.
Wow.
Okay,
Okay.
so that
Okay.
is the procedure.
Okay, so if someone was in a situation where, let's say they're hiking up in the mountains, they're not around anyone who are their, go-to people, no one who's informed about Lakeside, they fall and they're concussed, they're unconscious in that moment, and they have to be, boated back to the pier, and then an ambulance waits, picks them up, and takes them to the hospital. What happens in a situation like that?
That is a tough one. First, if you're going to go on a hike or whatever, you should always take your card, your laminated card with you.
Okay.
Okay. You should let people know that you're going on a hike just in case something happens.
Mhm.
All right. However, if you don't have, um, you haven't informed anybody, but you have that card in your wallet or in your purse, what most 911 responders or first responders in Mexico will do is they will go through your wallet to try to get identification or any instructions. So it is important to have some instruction in there. If something happens to me, take me to Vallarta Medical Center. Okay.
Okay,
And
that's
they
very
will know
smart.
that. Okay. So that is crucial. However, if they haven't done any of that, and they're taken to another hospital, somebody at some point has to call us. If they've already been um, allowed into that other hospital, they will have to check out and then be transported back to our hospital, our in-network hospital, and they will be responsible, obviously, for whatever bill was incurred in that first hospital.
Okay.
Okay, we can't do anything about that. They have to go to an in-network hospital.
They have to. Okay. And then in that
Yeah.
situation, if they were unconscious, for example, I I wonder the ambulance situation, just so that people know what to expect. Like, do
Yeah.
they have a preference of hospitals they take them to? Or, and then if that person can't talk or anything, would they treat them first? Or would they be like, well, until someone contacts us about this unconscious person, we're not going to do anything until we get a credit card? How does that work?
My experience in San Miguel de Allende, for example, which is another hotspot for expats. We've had cases of people who have passed out due to the heat, for example, during the summer.
Mhm.
And so they're on the sidewalk, they're unconscious. First responders arrive. It's usually the Cruz Roja, the Red Cross.
Mhm.
It's a volunteer organization.
Mhm.
They will look through to see who this person is, if there's a phone number, if there's some way to contact somebody, some instructions. That's what they're trained to do. Okay. And if there aren't any, they will take them to the closest hospital.
Okay.
Okay.
And
At that
fingers
point, that
crossed it's
closest,
an in-network hospital. Yeah.
fingers crossed. Like I said, I mean, even if it isn't at that point, they will probably be revived in the ambulance,
Mhm.
and they might be able to speak or give instructions, because the ambulance, the nurses will ask, uh, where do you want to go, or who are you, who you want me to call, because they want to inform people, right?
Mhm.
However, if the person is still passed out by the time they get to the closest hospital, that closest hospital is going to take them in on an emergency basis. They will go through their credit cards and everything, see what kind of insurance they have. But their first uh, idea is going to be to call somebody who is going to be financially responsible for that patient.
Okay,
Okay,
so it sounds like the number one best way then for people to prepare themselves is to print out and laminate some sort of an instructions,
absolutely,
probably in English and Spanish, maybe attach that
absolutely.
Lakeside Medical Group card to it, and
Yep,
then some instructions of who to call, and then inform their friends and family. This is, you need to call Lakeside first. Here's Robert's number.
yep,
Here's the agent's number. And then
yep,
this will cover all their bases. If they can't speak, their documentation will
absolutely.
speak for them.
That is what we and what's my wife did with SkyMed for many years is instruct people to print out the card, print out instructions, keep it with them at all times,
Mhm.
because the first responders will go through your personal items to try to find instructions, to try to find a contact, to try to get your name. right?
Hmm.
So they need all that information.
Okay, that
So
makes
it is
really
a good
good
idea to have
sense.
instructions. Yeah.
So then how does the 24/7 emergency hotline work? And I know we talked about which PV hospitals are in the network, but how does, if someone needs to call that hotline, how does that work for them?
Well, we have local numbers. For example, we have a TV number in
Hmm.
case somebody has a local phone. If
Hmm.
they have an American phone, we have an American 800 number that they can dial.
Oh, that's helpful.
Um,
Okay.
yeah, so we're always there, and at the back of your card will have about 6 or 7 different numbers that you can call.
Hmm.
Okay, they all go to the same place. They all go to the headquarters, and depending on where you are, you call those numbers.
Okay.
So you've got a local number, you've got a Mexican 800 number, and you've got an American 800 number.
Okay. So I know we did talk about what services are covered, what is an emergency, what is urgent care, the difference between ongoing treatments, chronic illness, things like that.
Hmm.
And then we talked about the clients paying out of pocket or there being a deductible or a copay. Is there anything you want to add to that, just to help kind of clarify exactly what the process will be? I know you mentioned that there's maybe 100 peso copay, and sometimes there's a 3,000 peso. So is
3,000 if you stay overnight, and
okay.
that's not 3,000 per night. It is 3,000 total, regardless of whether you stay one night or 7 nights.
Mhm.
Okay, so you'll pay 3,000 pesos. That's all you will pay. We will not charge the deductibles. We will not charge the coinsurance that your insurance has. The key to all of this is just having the right insurance policy from the US or Canada.
Mhm.
And by the right insurance policy, I mean an insurance policy that allows for treatment outside of the US or Canada, okay, for emergency and urgent care.
Mhm.
Once you have that, it can either be a Medicare or Advantage program, or it can be travel insurance, or it can be an international expat insurance. But once you have that coverage outside of the US and Canada for emergency and urgent care, we can take care of you, and your insurance is compatible with our program.
Okay. And so that brings me to a huge demographic of people that are considering moving to Mexico and needing support is our US veterans. So
Yes.
what can you tell me how we can support our US veterans? What kind of services that you offer for them? How does it work with their US veterans medical insurance
Hmm.
that they have? Tell me about that.
There are several types of insurance for veterans. You have TRICARE, um, which offers very comprehensive, wide-ranging, um, non-emergency and emergency services and treatments outside of the U.S. That is, excuse me, that is one of the top insurance policies that anyone can have, and we work with TRICARE without a problem. If you have
Okay.
VA insurance, okay, with your VA, outside of the U.S., the VA will only cover service-related conditions. Okay, so if you come down to Mexico and you have a service-related condition, we will be able to continue covering you for that. However, VA will not allow us to cover for any other conditions or treatments while in Mexico.
Including urgent and emergency.
Correct. They will not
Okay.
allow it. They
So
will
in
not allow
most
it.
cases,
Only it has to be service related.
it has to be service related. Okay. In
Yeah.
most cases, though, from your experience, Robert, do U.S. veterans have the VA or the TRICARE as well as an alternative insurance for
Not
emergencies?
everybody has a TRICARE. No, not
Okay.
everybody. That's only for certain members of the military
Okay.
and U.S. government.
Okay.
So they have, depending on, we've had people from the State Department, for example, that has something very similar to TRICARE. It's a Blue Cross Blue Shield, but it's basically Blue Cross Blue Shield program specifically designed for U.S. diplomats abroad.
Mm.
So once they retire, they can continue to use it. Okay, so it really depends. It's very plan specific. What we can, whether we can cover a certain veteran or not.
Mhm.
And if a veteran has a service-related condition, we can help them in getting the foreign medical uh, um, treatment guide because they need a special form to let the VA know that we are going to be treating them in Mexico.
Okay.
So yes, we can work with a lot of veterans. But we just have that specific requirement from the
Okay,
VA.
got it. Okay. But it does sound like, if I'm understanding correctly, that veterans seem to fall under the only group of people that, if they have an ongoing medical issue, service related, you can see that and it doesn't have to be an urgent or emergent thing.
That is correct.
Okay, that's
That is
actually
correct.
a good thing to know, because a lot of
Yes.
my clients and people who are relocating here are US veterans, and they're wondering, what is it that I'm covered for? I did all this
Sure.
service, and
Yep.
I'm already
Yep.
limited at what the
Yep.
VA or TRICARE will cover. Can you help me? And so I think this is really important to know. So if people have a particular Medicare Advantage plan, or they have a VA plan, or really any type of insurance, and they're already enrolled with Lakeside and they change it, does
Hmm.
does what do you recommend in that situation with their current enrollment at Lakeside? Should they call you and double check to make sure that the new plan
Yes,
is covered?
that is the best thing to do.
Okay.
Sometimes Advantage programs and plans change from year to year. So that's one of the reasons we request that people call us before heading to the emergency room, because we will also double check that they still have the same insurance policy.
Okay.
If it has changed, we can give them an answer in 2, 3 minutes whether we can still work with that particular insurance plan.
Okay.
Okay, because again, the service that we offer, our program, is very plan specific. So yes, if you're going to change, just make sure that once you change, you inform us, let us know that you changed, so that we can verify that that is a good plan. Or before you have to change, get in contact with us, and we will assist you, referring you to a Medicare agent who can put you in a new plan that is compatible with our program.
Okay, and then assuming it is compatible with the program, does that actually change anything as far as their enrollment? Do they have to like leave the enrollment and re-enroll, or are they just continuously enrolled and they don't have to do any?
They're continuously enrolled. The Medicare agent will take care of all of that. It will be seamless. It will be free. And also it's important to note that once we become involved, we are a Mexico-based program. Okay. Just because you're enrolled with Lakeside does not change anything with your plan in the US or in Canada, if you're back in Canada. Okay. So just being a member of ours does not modify your Advantage program or your health insurance plan at all. You can still continue to use it the way you've always used it in the US. Okay. And we're only offering our coverage while you're down here in Mexico.
Okay,
So,
got it. That's
okay.
good to
So
know.
there is no change to your plan.
Wonderful. So, what do you think is some of the biggest misconceptions that people have about using their US insurance in Mexico? Like some of the myths
The
that you
first thing
want
that
to
comes to
clear.
mind is most people say, "Oh, that's fraud," right?
Yeah,
And that's what most people think. Not most people, but a lot of people think. Why? Because they are aware of the traditional Medicare, that it cannot be used outside of the U.S. And they
right.
get confused because the whole Medicare thing is a little confusing. Okay, especially with the Advantage plans, where there are over 450 plans, and each one has a different, basically, limitation. They're all different. So it is all very plan-based coverage that we can offer here.
Hmm.
Okay, so most people have that misconception. The second misconception I would say is um, people just don't even think for a moment that their Medicare can or their insurance policy can be used down in Mexico.
Yeah, that's true. Nobody
That
knows
doesn't
that.
even cross their mind, and most people just go and buy a fairly expensive, because insurance policies here in Mexico are a little expensive, on the
Mhm.
expensive side, and are not exactly like the American or the Canadian insurance policies. There are major exclusions for pre-existing conditions down here, for example.
Mhm.
Okay, so there are issues. So it is worth um, finding out about it. I applaud you and your audience for trying to figure out and find out and get full information before moving down here.
Yeah,
Because a lot of people just move down here, like I did. We made the
like I
decision in
did.
6 days. Yeah. 6 days, we packed the bags and we moved down here and just locked the door in our Florida home. So that's what we did. And we arrived here and it's one hell of a learning curve, as
I
you know,
bet.
right?
Yeah. 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 6 days.
But
That's fast. You got me beat.
trying to get all this information beforehand is very important, especially with regard to health insurance.
Right.
So it is very plan specific. It is not fraud. Okay. And we are working with plans that allow for coverage outside of the United States.
So it sounds like then you would recommend someone enrolls with Lakeside Medical Group before they move to Mexico, not once they're here.
You can do either.
Either way. Okay.
I've had a good 20%, 25% of the people that enroll with me personally
Mhm.
are in the U.S. still. It makes it a little tricky because we ask for a Mexico address. So,
Mm.
some of them give us a hotel address or an address where they think they've already rented a house, but they're not living here yet. So we need that Mexico address,
Okay. Okay. And do
right?
you recommend in that situation that they use a hotel or something? Does the address actually matter too much other than just for
It matters from the
documentation?
standpoint that, we need to know where our people are, because our program has certain limits on the number of people we have per area. So from Puerto Vallarta, we may have a limit of, I don't know, I'm making up a number, 1,500 people,
Mhm.
memberships, right? Because we don't want all of our membership to be in one place or in two or three different places. Because we are constantly expanding our network of hospitals. Um, we're currently talking, for example, here in Querétaro, we're talking in several other places where we also want to have members to offer our network hospitals, right? So the address becomes important in that we can track where our people are.
Okay.
That's what I'm saying.
Okay.
So from that standpoint, it is important to have an address and to know
Okay.
where it is that you're going to move to.
Okay, well, if that's the situation and people don't have an address yet, they can just reach out to me and I'm happy to help find them a place that's trustworthy that they
There
can
you go.
rent and we can go from there. So are there
Exactly.
are there any situations where someone should not enroll with Lakeside Medical Group?
I can't think of one. That should not or cannot. That
Should
should
not.
not.
Should not.
No, I mean, like I said, if you've got Medicare Advantage, if you have a U.S. plan that allows for coverage outside of the U.S., it's a no-brainer. I mean, it's
Mhm.
not going to cost you anything. Uh, I can't think of an example why someone should not enroll. I mean, even if they don't want to use it, just having it as a backup plan, plan B, plan C, would be a good idea.
Yeah,
So
it really does seem like a no-brainer. Like why if you're not paying for anything
there's
until
no cost
until that
involved in it.
copay, which is like nothing, that's less than my
Yeah,
coffee costs at the Starbucks, you know? Like why would
absolutely.
you
Right.
not, you know? So
Right.
okay, so you've mentioned that your providers are bilingual or that they do have bilingual people on staff because that's a big concern for a lot of people if they don't speak Spanish. What do they do? You
Yeah.
obviously are, American, so you speak perfect English. So if they call you, they can get that service. But can clients choose their own doctors and clinics as long as they're within the network? And are they bilingual?
Yes. Yes. They can choose
Okay.
as long as people are, and in our website, which is www.lakemedicalgroup.com.
Okay.
There is a drop down menu of, where you're going to live. And then there's a drop down menu of what our doctors are, who our doctors are in that area and what hospitals we have. But remember, most of the doctors that are members of our program are in the urgent care and the emergency care areas. So it's not your everyday doctor that you're going to go see,
Right.
right?
Okay. Okay.
Because we won't be able to cover those visits.
Mhm.
So really, the most important thing is to have a good hospital,
Mhm.
and you know where it is, and you've got to visit it, and you understand how they work. Because for emergency and urgent care, that's the place where you're going to go.
Mhm.
And most of the doctors in the emergency room work for the hospital.
Mhm.
doctors that are not in the emergency room are generally self-employed. They're 1099ers, so to speak,
Mm-hmm.
independent contractors. So they go between hospitals, so they may choose a particular hospital. If they're not member, our 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 member can request for that doctor to become a part of Lakeside. However, not all doctors may want to do that because either they don't do urgent care or they don't do emergencies, right?
Mm-hmm.
But the most important is to be satisfied with the hospital and know where it is and know how they work, because
Mm-hmm.
that's where most of your care is going to be taken. We're going to take for your treatment.
So, and it sounds like you guys already work and have partnered with the best hospitals in the city with Vallarta
Yes,
Medical
in
Group and
Vallarta we certainly
MedAssist.
do. Yeah,
Yeah. So then to cover the rest of Mexico, like how many different regions are you in? It sounds like you guys are all over the
we're in
country.
27 different cities and
Wow.
expanding.
Wow.
Right.
Okay.
So if you're in Vallarta and you want to go visit Guadalajara from Vallarta, we have some terrific hospitals in Guadalajara. We have terrific hospitals in Chapala. A lot of Vallarta people go to Chapala just
Hmm.
for a little change in climate, et cetera, et cetera.
Yeah, they don't like the rainy season here. They like it more dry over there.
And yeah, the hot and sticky season.
Yeah.
So they go to Chapala for that. So we've got some terrific hospitals there. We've got terrific hospitals in San Miguel de Allende. Excuse me. So we have hospitals all over the place.
Okay, that's great. So even if people are traveling, they can kind of plan where
Yeah,
they're going to be traveling across Mexico to, plan where the in-network hospitals are in
yeah,
case something happens, add that to their instruction list that is going to be in their wallets, attached to their Lakeside Medical Group information,
right,
so that an emergency care person can access that, find it, know where to
correct.
take them and what to do with them. So that's wonderful. So I know you mentioned that your website, you said lakemedicalgroup.com. Yeah.
Sorry, I lost you there for a second.
Oh yeah, it froze for just a second. This is a wonderful thing about Wi-Fi in Mexico, right? So you mentioned that your website is lakemedicalgroup.com, right? Is that correct?
That is correct. Yeah.
Okay, so if someone is ready to enroll and has more questions, what's the best way for them to reach you? Is it through that website? Is it contacting you directly? How do you recommend they go
They
about
can
that?
they can email me directly, ASH at lakemedicalgroup.com.
Okay,
I will
perfect.
be very pleased to answer any questions they have. They can email you directly and you can forward them to me.
Mhm.
I think that might be the better way to do it. That way you can also make sure that they're taken care of and in
Mhm.
terms of all their needs.
Mhm.
Um, so I think, yeah, that would be the best way to do it.
Okay, guys, so we're
Just
going to
reach
go
out.
ahead and we're going to link all of the stuff in the comments below so that you guys are able to find that information super, super easily. And you can get in contact with me, and then I will make sure to put you directly in
Yes,
contact with Mr. Robert here, and he will take great care of you. So, Robert, we covered a lot of information today, really, really a lot of
we
stuff.
did.
Is there
I
any
almost lost my voice doing it.
Yeah, you did great. You did wonderful. Round of applause from all of us in your audience here. So, is there anything else that you think that our audience, our clients, people relocating to Mexico, people maybe who are not even sure yet that they want to live in Mexico, but
Yeah.
maybe you can tell them to reassure them in their decision to move here and why this could be the
Well,
best
I've
move?
lived here for 20 years. Absolutely love it. I've met other Americans who've been here longer and never left. Um, Mexican people are absolutely wonderful,
Mhm.
very warm, very welcoming. They want to share their culture. They want to share their food, their music. The culture down here is absolutely extraordinary.
Mhm.
If you're into music, if you're into even different drinks, I mean it's amazing what you can find here. It's a wonderful place. It's very livable. Don't believe everything the media says
Yeah,
because
just
it is
ignore
not
it.
true.
Yep.
Yeah, it's not true. Um, and I thoroughly recommend it. I
Yeah.
absolutely thoroughly recommend it.
Yeah, absolutely. Same here. Well, Robert, thank you again so much for taking the time to have this interview
Well,
with me
thank you.
today. You were super, super helpful. Honestly, you seem super competent in what you're doing. Very, very trustworthy. We've talked a few other times as
Thank
well,
you.
so it's really, really great to get you in front of my audience and just share the knowledge that you have
Anytime.
and the support and the services that you offer. So I think this is going to
Sure.
make everybody, whether you're retired, whether you're a digital nomad, whether you're a family looking to move abroad with young kids, whether you're a US veteran, Canadian, anyone from around the world, I think you've provided a lot of reassurance for them today to be able to make the move
Great. I
to,
hope so. Thank you. And
yeah.
thank you for the invitation to speak to you and your audience. I think anyone seriously thinking about moving down here is I think they're doing the right thing. And I think they're doing the right thing going through you. Your services you offer are absolutely fantastic. You've got a great name, great reputation, and they can't go wrong.
Thank
So
you. I
thank you for
appreciate
having
that.
me here.
Yeah, thank you so much, Robert. Well, again, everybody, I'm going to link all of the information in the comments. If you need to reach out to me directly, you can contact me through my website, www.mydestination.com. Don't forget that's destination with a Z because I'm Des. You can
Very
also
clever, very clever.
Thank you. Thank you. Came up with it all by myself. You can also email me directly, des at mydestination.com, also with a Z as well. And I've got many more resources like this on my website, on my YouTube. You can follow me on social media at my destination as well. So we look forward to providing more content like this for you guys so that you can learn how to move to Mexico the easy way, the legal way, the stress-free
Yes.
way. We've done it. Robert and I have done it. You can do
And
it
we
too.
survived
And we
and thrive
survived.
now.
And exactly that. Yes. So thank you again,
Yeah.
Robert. And we will talk
Thank
soon.
you.
Okay.
Yep.
Adios.
Take care. Bye bye. Thank
Bye.
you.